Hello, dear guests. We're together with you again on another health program. Today's guest is specialist in physical medicine and rehabilitation, Dr. Erhan Çetin. Welcome, Mr. Erhan.
Thank you.
Could you please introduce yourself? Who is Erhan Çetin?
As you mentioned, my specialty is physical medicine and rehabilitation. After graduating from medical school, we complete 5 years of specialization to earn this title. Currently, I am working in my field at Luton Hospital in Fethi.
Yes, I have just met you as well. Actually, you caught my interest too. So, when it comes to physical medicine and rehabilitation, it's not something we've encountered very often before. Usually, in the field, either orthopedists are well known for this subject, or the people we see in the field are physiotherapists. I believe that many of our viewers are also very curious about what makes you different from them. Could you explain what exactly do you do?
Well, so physical medicine and rehabilitation. We call it PM&R for short. Maybe it'll be quicker if we use that. In PM&R, first we complete 6 years of medical school, just like in other specialties. On top of that, we do a 5-year residency in physical medicine and rehabilitation, earn the right to specialize in our field, and continue our medical practice as specialists. Just like orthopedists, general surgeons, or internists. In other words, like all doctors who are specialists. So, our field is physical medicine and rehabilitation, as the name suggests, physical medicine. So, some physical agents are used in this branch, and rehabilitation, that is, the reintegration of the people, in other words, if we talk in layman's terms.
Lost.
We have a mission to regain what has been lost. So, the difference between us and physiotherapists is this. Our physiotherapist colleagues complete a 4-year physiotherapy program and gain the qualification to perform physical medicine and rehabilitation practices, but only with a doctor's prescription. In other words, they do not have the authority to make decisions or diagnoses themselves. During our specialization, they proceed by applying the prescriptions we provide and by following up with the treatments we supervise.
That's how they progress.
The fundamental difference between our specialized approach and that of traditional orthopedists is quite significant and can be summarized as follows. If there has been absolutely no traumatic event involved, for any persistent kind of joint pain, chronic back pain, nagging neck pain, or even bothersome shoulder pain, in other words, for a wide array of issues directly related to the intricate joints, the surrounding muscles, the entire skeletal system, or indeed the complex neurological system, if there hasn't been a sudden fall, a forceful impact, a severe sprain, an unnatural twist, a significant car accident, or anything of that nature occurring beforehand, then patients should, in fact, come directly to our highly specialized medical practice for appropriate and timely care. This is our difference from orthopedists. Orthopedists are known as orthopedics and traumatology, as the name suggests. They are more concerned with the trauma department. Well, of course, there are also brain surgeons. Neurosurgeons, especially patients with a herniated disc, usually go to the neurosurgeon first. Well, this is actually a common mistake, because the brain surgeon is the surgeon of this job. In fact, you need to come to us first. We send a patient who needs surgery to a neurosurgeon anyway. And our goal is to treat people without traumatizing them, that is, without sending them to surgery as much as possible, and of course, without abusing this. What do we do when treating? We use physical agents. What are these? It is known among the public. They say they connected us to electricity, what we call TENS. This is a machine. We do an ultrasound, or rather we write it down. Our technicians implement it. We have laser applications. We also have vacuum therapy applications. We have many different types of treatments. We prescribe these according to the patient's condition. And our technicians or physiotherapists carry out these treatments, and we monitor the process to decide whether there is improvement or if the treatment should continue. So, in a way, you could say we are the decision makers in this matter.
Well, back in the day, there was this thing. You know, on those national TV shows with doctors, there was a time when surgeries were done very quickly, but then the focus shifted to rehabilitating the issue without surgery, or not letting it get to that stage. Because, for example, after a surgery done at the first stage for a herniated disc, there might not be much improvement. So people were also losing the option of surgery when they had it at the very beginning. Whereas, instead, let's try to heal first, do everything we can, and let surgery be the last resort.
Yes, in fact, this is the most important point that needs to be considered. For example, if you want, let's talk a bit specifically about herniated discs. Now, after a herniated disc surgery at the site where you operate, a scar tissue forms. That is, as it heals there, the tissue can actually grow even more. In fact, there are certain risks of complications after the surgery. It's not like they don't exist. These can't be ignored. But in physical medicine and rehabilitation, that's not the case. Especially after applying certain physical agents, we can actually cause the herniation to regress. Regression is, of course, a good thing. It's what we hope for, but it needs to be emphasized. There are also patients here who have a surgical indication, meaning they actually need surgery. I mentioned misuse in relation to them. We can't say, I'll cure you with physical therapy. We actually refer those patients anyway. So if the herniation is seriously compressing the nerve, if it has caused nerve damage above a certain threshold, if irreversible damage has started, we tell that patient, you definitely need surgery. We say, this isn't something that can be fixed with physical therapy, but this isn't something that's especially common in herniated discs. That's why it makes much more sense for the process or the first step to start with us. That way, patients don't have to go around to a lot of places.
Me.
And if necessary, they can be referred to a neurosurgeon by following the proper steps.
Yes. But let's say, if your treatment gets a response from the patient, can we at least say that they'll have a more comfortable and functional life? And at the very least, their pain and discomfort will go away?
Of course, actually, in some cases, especially in certain cases, for example, let's say the patient actually needs surgery. We're always talking about herniated discs, right? They need surgery, but due to osteoarthritis, that is widespread calcification, there's significant muscle weakness. So to reduce post-surgery complications, in some patients, it's necessary to do physical therapy before the operation as well. With physical therapy, you prepare the patient for surgery and even continue after the operation to teach the patient proper back care, in other words, to help them gain an activity routine. These are all part of our specialty. Yes, it's a bit complicated, a bit lengthy. We're involved in almost every field. For example, we're present in neurology. In neurology, we can talk about strokes. When it comes to strokes, which we call paralysis, like right side paralysis, left side paralysis, or widespread paralysis, of course, the patient will first go to a neurologist, or if necessary, surgery will be performed. The neurosurgeon will operate, remove any clots if there are any, stop the bleeding if there is any, and then the treatment of the remaining damage is up to us. So this is where the rehabilitation part begins. By using brain plasticity, in other words, relearning, we try to bring the patient as close as possible to their previous state, or even back to their original state if possible, through rehabilitation programs. For this, we have special exercise programs. We also have various physical agents that we use. We have devices that we use. Plus, I need to mention a very important point here. We shouldn't be unfair to our physiotherapist colleagues. We have physiotherapists. So, under our supervision and with our guidance, the therapy they provide is very important. At this point, I also want to emphasize something. We are a team. In our field, there is no such thing as a doctor working alone. We need to have a physiotherapist, and we also need to have a physical therapy technician, but only if we can work together as a team.
With the broadest sharing.
Yes.
It's almost like a specialty field, isn't it?
Yes, exactly.
I mean, in other fields, the scope is narrower and they specialize only in matters that concern themselves, but you have to be in close contact with many other branches
Of course.
so that the patient's comfort increases, their pain decreases, and you can find a solution to their problem.
For example, let's consider a scenario where a patient has had a serious accident and unfortunately lost a leg. Actually, making a new prosthesis for this and preparing the patient's muscles for it, rehabilitating them, is also part of our field. So it's truly a very broad specialty. But since it's not well known, it's not a branch that people come to very often, normally. Usually, patients are referred to us from other specialties. Sorry.
Yes. So, what kind of challenges do you face? Usually, a diagnosis is definitely made for the patient, and most likely a program is written. Within the framework of that program, the patient starts rehabilitation. What is it here that challenges you? Is it that the patient gets bored after a while and quits? Or something else?
That's actually one of our biggest problems. It's very important for the patient to believe in it. Now, we don't just stop the pain by giving a strong painkiller and opiate. What we actually do is teach the pain to subside gradually. So that's why it requires patience, and to be honest, our people aren't exactly known for being very patient. That's why our patients usually end up like this. They go around to many doctors, and finally they say, let's try the physiatrist too. Among the public, we're known as the physiatrist. They say, let me go to the physiatrist. So they come to us, and when they show patience and realize they've gotten better, they are surprised. They say, if we had known, we would have come earlier. But this is actually one of our biggest challenges. Secondly, the patient's compliance with the treatment is very important. I mean, if you give the patient an exercise program and they don't do it at home, well, there isn't much more we can do.
But I also noticed something. Generally, I know that they also get support from the hospital. I mean, you have a special department there where patients.
Of course, what we mean by a special department is that there are exercises the patient does themselves, which we call active exercises. And then there are passive exercises, which are exercises performed by our physiotherapist for the patient. So let's say it's an elbow fracture. The elbow has contracted, meaning it won't open. Stuck, it stays right here. Now, no matter how much you explain this to the patient, like put it in hot water, then try to open it yourself, is actually a very painful process. So it's not really possible for the patient to do it on their own. And also coordinating those muscles, making the opposing muscles work properly while doing it. These things are only possible through rehabilitation, specifically orthopedic rehabilitation. That's where our physiotherapist steps in, and together we try to open it up.
I see. Is it that? Is it, as you said, calcification in some elderly people? Like either the finger gets stuck just like that, or the arm doesn't move as much as it should.
Of course, I mean, this is what we call osteoarthritis, basically the joints turning into bone, so to speak. So it occurs as the soft tissues of the joints gradually start to ossify and harden.
Is there any way to reverse this?
In old age, there's usually not much chance of reversal. I mean, if a serious contracture has developed and the person is quite advanced in age, rather than restoring it to its original state, what's more important is to control the pain and make the joint a bit more functional.
Yes, there was a time, about 20 years ago, when preventive medicine was really popular. Basically, people were encouraged to go to hospitals or medical centers before they got sick. The idea was for them to take precautions against diseases that might develop in the future. So, before they actually became patients, is this something that's possible in physical medicine? So, if someone comes to you before, say, their finger or hand actually gets injured, could you provide guidance?
Here, yes, we can offer some counseling in this area. So what can be done about this? There's a very common misconception among the public, for example. People think, I already exercise a lot, I play ball, I do this and that, but actually too much exercise can also be harmful to the joints. This needs to be evaluated carefully as well. Consulting services can be provided, but this kind of preventive approach, preventing illness before it happens, is actually more a matter of public health. So this is more possible through mass awareness and education. This is actually one of the biggest shortcomings in Turkey, and that's really a whole separate topic, actually.
I see. And there's a question I ask almost every doctor who comes on. And here's the reason why. People are really worried about their health right now, especially after COVID. For example, there's a pharmacy right below my workplace. Even if I just go in to say hello, someone will say, hey, this part of me wasn't hurting until yesterday. Now suddenly it hurts like this, it hurts like that. Or, for example, just a little while ago you mentioned something. Blood clots are really popular these days, as is heart attack, which isn't necessarily age-related anymore. I absolutely don't want to question things like that. It's not possible to just say, oh, it's because of the vaccines or something like that. Vaccines undeniably provide support in preventing certain things. But this increase, people didn't used to talk about it this much. There were still deaths for certain reasons. People still had aches and pains for various reasons. For example, I remember something. Let me say it without naming names. A couple I know who run a small business, they say, at night, the pain gets so bad we end up screaming. This was right after COVID. I thought about it afterwards. Now, during the COVID period, people were really inactive. Let's say, in daily life, we inevitably move around a lot. We go here, we go there. But otherwise, most people, especially during COVID, ended up living completely sedentary lives in front of the TV. Is it just that, or was there really something that triggered it?
Now, this immobility you mentioned is a very important reason. I mean, it's a really, really important reason. So I attribute the vast majority of these current complaints to that. The joints became inactive, the body became inactive, the mind became inactive. I mean, everything suddenly became inactive for 2 years. This is a very significant factor. But is it due to COVID? I mean, is it because of the vaccines, or is it due to COVID itself or the virus? We'll only see the results of this much later. Of course, medical research is being conducted on this. So that's why we can't say for sure that this is the cause. As you said, awareness has become a bit more sensitive. We started attributing pain to COVID. This is common among the public. Or a patient who can't accept something about themselves might say, this happened because of COVID. So we might have exaggerated something that already existed too. But as a doctor, I can't give a definite answer to this. Scientifically, a definite answer might take maybe 20 years.
I see, I understand. So you just mentioned vacuum devices or other things. What kind of artificial intelligence support tool is it? These days, it's started to be used a lot, especially in medicine or in every sector around the world. In your sector or your area of expertise, what kinds of technological support do you use?
Well, in our field of physical medicine, as we mentioned earlier, the physical part involves physical agents, that is, the use of certain devices. And of course, these devices are constantly being modernized. I mean, they're always being modernized. So it's impossible to compare a device from 20 years ago with the ones we have now. That's why it's very important for units, that is, physical medicine and rehabilitation units, to be updated with these devices. In other words, acquiring new devices or upgrading existing ones is very important. For example, in our hospital, we've just acquired the latest model devices. We're waiting to serve the public with them. In other words, we're quite ambitious about this. Maybe, I don't know, in 3 or 5 years we'll say, this is no longer sufficient, there's a more advanced version of this now. If you can keep up with this, you'll be more successful in the physical aspect of physical medicine. But you can't achieve the same success with a 30-year-old device. Let me give you an example from one of the devices. It's known as ESWT. It stands for extracorporeal shock wave. Our people know this as kidney stone breaking. It's basically a different version of the shock device used for breaking kidney stones. We use this for what we call enthesopathies. People know them as tennis elbow, golfer's elbow, and heel spurs. These kinds of issues are very common. Especially among the people in this region, heel spurs are quite prevalent. I see it very frequently in women, for example, especially those working in the fields. We often encounter it in women who wear those thin-soled rubber shoes. It's something you need to pay attention to. This is actually a very effective treatment here. In fact, it's currently the first-line treatment accepted worldwide. They say, let's apply ESWT directly to the patient. Since W is hard to pronounce, I just say W. So it's applied for about 5 sessions with 2 or 3 days between each. And you really see its effect in a significant way. For example, even for heel spurs. Now, for instance, there's a new device. It's called high-intensity laser. This device is especially effective for pain control, and it's very effective for muscle relaxation in frozen shoulders. High-intensity laser, or as people generally call it, therapy. Other devices like vacuum or interferential current. You apply electricity to several points at once by creating a vacuum. It's like cupping therapy.
Yeah.
It's kind of a modern version of cupping. Then there's the TENS machine. That's already something well known. Ultrasound, regular Razel, those are already familiar things. The purpose of all these is to relax the muscles in that area, increase blood flow, and control pain.
And maybe to speed up the healing process as well. The main goal is, for example, if you relieve the spasm in a herniated disc and make the patient comfortable, that device doesn't directly eliminate the herniated disc. Once you provide relief to the patient, there's a chance that the hernia could disappear within a year. The body gives itself time to repair.
You're actually giving the patient time.
Actually, it's a great thing. Why, you might ask? We're people who are afraid of even the smallest aspect of surgery. When you look at it, we're talking about a surgery. Maybe the comfort of the process takes a bit of a hit, but honestly, we shouldn't even see it as a problem. One mistake I've observed. Unfortunately, we Turks aren't people who like to move around a lot. I mean, just look at it.
What you're saying is really simple. I want my car right in front of my door so I can get in, but I also want to park right in front of the grocery store and get out, even if it blocks traffic. Really, I always use this example. That's honestly how we are. We really don't like it at all.
But you know, it's like, when things get tough still, you know, if the price we have to pay is just moving around a bit, sweating a little, or doing the exercises the doctor recommends, in my opinion, that's a much more comfortable treatment process than surgery.
It's both comfortable and economical.
Yeah.
The treatments we're talking about here aren't expensive at all.
Well, I think that's usually what people are hesitant about. Like, now we have to go to physical therapy, come back, it's the hospital and all that. But I know that sometimes, you go to the public hospital here and end up waiting for hours or even days just to get an appointment. Of course, you act according to your purchasing power, but I know that treatment prices in Fethi are much more affordable. They're nowhere near as expensive as the big hospitals in Istanbul or Ankara. So, in my opinion, at least we're all civilized people. You meet with the doctor, and a treatment plan is outlined. So, like, how many sessions should I attend? How much will it cost me? And on the other hand, there's this whole weighing scale thing. Why put both sides on the scale? You're going to be put under anesthesia. Even if every surgery only has a 1% risk, there's no guarantee that 1% won't happen to you. So, feeling a bit uncomfortable about this, maybe later on, as you said, the cost of surgery will be higher.
Actually, I should mention this as well. When we talk about our field, we've always talked about devices and movement, but we also provide other treatments. So not every patient who comes to us necessarily has to undergo physical therapy or go to the unit. We also treat certain rheumatic conditions. We also perform local injection treatments. In some cases, if we have a solution that can be resolved with a single injection, of course, we don't make the patient suffer unnecessarily. We do that and try to relieve the patient. So going to a physical therapy specialist doesn't necessarily mean you will receive physical therapy. A physical therapy specialist, especially when it comes to what we call the locomotor system, that is the skeletal, muscular, and neurological systems. So when you come to us, you can get really good consultation here. Our examinations take a long time. They're not like other checkups. Because we're looking at the locomotor system, we have to evaluate everything about the patient. That's why, at the very least, the patient can learn very clearly what they can and cannot do. That's why I say it's important.
Honestly, even from this relatively short conversation, it genuinely seems to me that if you're going to go to a hospital for virtually any reason at all, this particular specialty should absolutely be the very first one you consider seeing.
Well, I can't say for any reason, but when it comes to the muscular and skeletal system,
Oh, muscular and skeletal, of course.
and definitely anything related to the neurological system,
At the very least, you would provide the right guidance. Like, if this is beyond us, it would be beneficial for you to consult a colleague from that specialty. Or if that's not necessary at all, we can handle this together without resorting to surgery and by preventing the patient from undergoing long or incorrect treatments that would disrupt their comfort. You would at least make the correct diagnosis. Or if not, it would seem as if you had.
exactly that's how we see it too.
Well, that was very informative. Is there anything you'd like to add, so as not to bore the viewers too much? We usually don't make it too long, but here's what we do. If any of our viewers have questions, we'll share either our email address or yours below the program. They can ask us or you there. After that, either we pass on the answer we get from you to the viewers, or you do, something like that. But is there anything left that we should have talked about or that you could ask or answer after this conversation?
I mean, I'm sure there is.
There definitely is.
If we sat down, we could talk and explain until morning, for sure. But of course, for now, I think we've talked about a lot.
I see.
I think we've covered the main topics that needed to be discussed.
Would you recommend it? Would you recommend this specialty to young doctors?
Let me put it this way, this specialty really needs to fit your character. I mean, for example, most doctors who enter medical school don't know this either. Students don't know it either. You only realize and learn about physical medicine as you progress in the field. Back in our day, physical medicine and rehabilitation was a 2-week internship in the 5th year. So that's why, but of course, today's doctors are a bit different. That's why, of course, I would recommend it. Of course, I want better doctors to be trained in my specialty. But I think it's better for doctors to choose the specialty that suits them best after going through the process in medical school. I mean, to pick something that matches their own character. But unfortunately, we also have a problem here. I don't know, should we mention this? Especially in surgical specialties, they're not really preferred much anymore in Turkey. Because there are some very serious problems in our country regarding this. People are on call day and night. Our friends really suffer a lot during their residency. And when they graduate, they don't really get what they deserve in return. Because of this, surgical specialties have become a bit harder to choose. They're tough specialties. Well, maybe not tough, but demanding. Pediatrics, for example, is truly a specialty that requires a lot of patience. Not everyone can be a pediatrician, for instance. But if we don't pave the way for those who do, now there are very few doctors who want to become pediatricians. We really need to evaluate these things carefully. Of course, at this point, policies also start to come into play. Let's try not to send our doctors to Germany if possible. Let's keep them here as much as we can.
Because when you look at it, we all need them. One way or another, it's inevitable. One day you'll find yourself walking through the hospital doors. You end up needing support from a doctor or a healthcare institution. The more motivated we can keep them, I believe the patient treatment processes will also become shorter.
Absolutely.
They'll also communicate better. Actually, when we started this program, this is what we had in mind. Usually, patients go to the doctor with a kind of illness psychosis, with low morale. The doctor, caught up in their own troubles, doesn't communicate much. In fact, they usually don't even have the time to do so. So we thought, at least if people watch us in a broader, more conversational setting, we can guide them about what should be done and how things should be. In this context, at least before going to a doctor, which actually happened to me. In the situation I just shared with you, I went to the wrong doctor. Actually, you were the one I should have come to. So at least from now on, I think I need to change my physician. Even on this topic, I think we've created, or will create, at least some awareness after this program. Thank you for the information you've provided. We're glad you exist, and we're glad you came.
Thank you very much for inviting me as well. Thank you so much.
Thank you. Dear viewers, our program for today ends here. If you have any questions about physical therapy and rehabilitation, or about any of the many things the doctor mentioned, like improving your quality of life, reducing your pain, or increasing your functionality, which is why this field is considered one of the most logical specialties for essential tasks, please send your questions to the doctor's email or our email, which you'll see below. We will share them with the doctor and get back to you afterwards. We're glad to have you. Stay healthy. Take good care of yourself. Goodbye.